Okay, we're going to start this chapter. This is a long chapter, but I'm going to try to get through all of it today. I'll keep my eye on the clock, and I'll try not to go too long. If I can get it in under 2 hours, I think we'll probably go ahead and finish the whole thing. This is about opiates, opioids, sedatives, and hypnotics, and sedative hypnotics. Actually, okay, well, anyway. Depressants depress the activity in the central nervous system. They sedate. They cause muscles to relax. They may depress inhibitions. They may depress your emotions, and they may make you impulsive. They mimic the natural inhibitory neurotransmitter, the endorphins, the enkephalins, and gamma aminobutyric acid, or GABA. The three major classes of downers are opiates, and opioids, and we're going to explain that in just a second. Opiates, of course, are come from the opium poppy, and opioids are synthetics. Turns out that opiates are it's not that simple a chemical, but it's easy to, well, it's not that easy to make either, but it's fairly easy to manufacture. Sedative hypnotics, and then alcohol is also a downer. So, four minor classes of depressants are skeletal muscle relaxants, antihistamines, over-the-counter depressants, and look-alike depressants. Now, when we talk about look-alike depressants, these were real popular back in the 1980s. They're outlawed in the United States now, so we don't see them anymore. But once upon a time, we did see a lot of look-alike depressants. Opiates, opioids, opium, morphine, codeine, hydrocodone, oxycodone, methadone, and heroin. Another name for hydrocodone you may have heard of, Vicodin, and you may have heard of OxyContin, as that's the oxycodone. Originally, it was developed as a painkiller, as a cough suppressant, and to treat diarrhea. The sedative hypnotics are synthetic chemicals developed to treat anxiety and insomnia. They include neprobamate, meprobamate, that should be an M. It's also known as Miltown, phenobarbital, seconal, Dilaudid, methaqualone, which is also known as Quaaludes, flintrazepam, which is also known as Rohypnol or Roofies, GHB, which is a date rape drug, as is Rohypnol, and the benzodiazepines Xanax and Valium. Alcohol is the natural byproduct of the fermentation process of plant sugars or starches. This is the oldest psychoactive substance used by humans. Alcohol is the world's second most destructive drug after tobacco. Skeletal muscle relaxants are synthetically developed central nervous system depressants that target the area of the brain responsible for muscle coordination and activity. And I'm not going to talk about the chemical names. These are names you may or may not have heard of. I've heard of them, of course, because I worked in medicine for such a long time. Soma, Paraffin Forte, Flexeril, Lorisol, and Robaxin are fairly common. Librium is also muscle relaxant. Antihistamines are found in cold and allergy medications to block the neurotransmitter histamine. The synthetic drugs are used to treat allergic reactions like Claritin, prevent ulcers like Prilosec, prevent shock, prevent rashes, prevent motion sickness, and prevent symptoms of Parkinson's disease. Over-the-counter depressants, sleep aids, or sedatives such as Nitol, Sleepies, and Sominex. I'm sure you've heard of those. Wait a minute, let me write this down. There we got it. Okay. Active ingredients, scopolamine. Scopolamine is the truth serum. So these over-the-counter depressants have Truth serum in them, antihistamines, bromide derivatives, and most of them have alcohol in them. Okay. All right. Look-alike depressants are rarely seen today, as I said before. They have been outlawed. They were very popular in the 1980s, and now we don't see them hardly ever. So we're not really going to talk about them. Dilaudid is one of them, but we never see them now. Opiates are products of the opium poppy. Opioids are synthetic versions of the opiates. Opiates come from the milky sap that oozes from the unripe seed pod of the flower. It will ooze for about a week. It can be milked about 6 times in any given season, and that's what it looks like when it oozes. That stuff's really sticky, so they usually harvest it with a knife blade. They scrape it off. Opium products produces over 25 alkaloids. The two most important are codeine and morphine. Codeine only makes up 0.7% to 2.5% of the opium exudate. Morphine makes up about 10 to 20% of the opium exudate. A third alkaloid that is a stimulant rather than a depressant is thebaine, and I haven't heard of them using that actually. Semi-synthetic opiates are opiates that are refined in a select way to produce a psychoactive substance that is partially natural and partially synthetic. That includes heroin, Vicodin, Percodan, which is another name for Oxycodone, and Dilaudid, Hydromorphine. Dilaudid, Vicodin, Percodan, heroin. Fully synthetic opiate drugs include Methadone, Meperidine, another name for Demerol, and Propoxyphene or Darvon. Synthetic opioid antagonists, there are 2 of them, naltrexone and naloxone. Naloxone is a short-acting antagonist of the opiates. Naltrexone lasts for about 3 days. Now, naloxone only lasts for a matter of minutes. Opium poppies were first cultivated in ancient Mesopotamia. That is in that area between the Tigris and the Euphrates River. It then spread north to Greece and west to Egypt, eventually making its way east into Asia. Opium was used in many medicines in the Old World, but its ills were seen even then when various writers wrote of its addictive properties. Opium tended to be used as an additive. It was eaten, it was chewed, or it was mixed with liquids and drunk. In the early 1500s, opium regained popularity when the Swiss chemist Paracelsus began making a tincture. A tincture is something mixed with alcohol. The alcohol makes it a tincture with the opium powder, and this he called laudanum. Laudanum was used for dysentery, it was used for pain, it was used for diarrhea, and it was used for coughs. And it worked. It actually took care of all 4 of these problems. Laudanum's been around for a long time. And if you've watched any movies about the gunfight at the OK Corral, Wyatt Earp's girlfriend was strung out on laudanum. Opium continued to be used in medicinal mixtures for the next 3 centuries. Paregoric is tincture of opium with camphor. It was developed for the treatment of diarrhea. This mixture is still used today. My mother had, back in the 60s, my mother had gallbladder disease, and it was causing her to have fairly consistent diarrhea. And what they gave her to control the diarrhea was paregoric. Opium smoking became popular in the 16th century. This means of drug introduction puts more of the active ingredient into the system faster. It takes it only about 7 to 10 seconds. Because the psychoactive ingredients enter the bloodstream and brain faster, there is a greater sense of euphoria, well-being, and relaxation. Modern methods of smoking heroin involves heating the substance in tinfoil and inhaling the fumes through a straw, and this is known as chasing the dragon. And this is what it looks like to chase the dragon. As you can see, she's got a piece of tinfoil. She has the opium on the tinfoil, and she is cooking it with her cigarette lighter and sucking up the fumes with the straw. As weird as that looks, chasing the dragon. In 1805, the morphine alkaloid was first isolated from opium and was found to be 10 times stronger than opium and thus a more effective painkiller. Morphine was first used in the Crimean War from 1853 to 1856, and that was a war between England and Russia. And then it was also used during the American Civil War. Opium poppies were actually grown in the South to provide morphine for the Confederate troops. In 1832, the weaker alkaloid codeine was isolated from opium. It was found to only be twice as strong as a painkiller as opium. Codeine was used to treat coughs and general neuralgia. So it made you, they would give you codeine to if you had a cough, such as tuberculosis or grip, what they call a grip, which was the flu. And if you felt kind of blue, that's what neuralgia actually has to do with muscle pain, nerve pain. They would give you codeine and it would take care of that pain. In 1874, a British chemist boiled morphine with acetic anhydride to create an opiate synthetic that was 5 to 8 times stronger than morphine. Bayer Pharmaceuticals of Germany bought the chemical and named it heroin. And the reason they did that is because they said the effects were heroic on the individual. So they called it heroin. Bayer marketed it as a pain suppressant, as a chest painkiller, and as a treatment for tuberculosis and pneumonia. Heroin crossed the blood-brain barrier more rapidly than morphine. The result was a more intense and rapid rush in euphoria. It is estimated that at the turn of the 20th century, there were between 250,000 to 1 million morphine and heroin addicts in the United States. But heroin at the time was legal, so they were not criminals of sorts. Through the 1800s, patent medicines were produced that contained opiates. These patent medicines were used for such problems as tired blood, colicky babies, as you can imagine, giving opium to babies, for coughs, of course, diarrhea, and toothaches. They were used to quiet loud children and to aid in sleeping. Surprisingly, surveys showed that more than half the opium addicts were women. About 56 to 71% of all the people that were hooked on this stuff were females. Famous opiate addicts of the 19th century: Jane Addams, who was the first social worker out of Chicago. Sarah Bernhardt, who was a famous actress at the time. Elizabeth Barrett Browning, who was a poet. Charlotte Bronte, who was an author. Louisa May Alcott, who wrote Little Women. She was also an author, of course. Samuel Coleridge, who was a poet. Charles Baudelaire, who was a French writer. Lord Byron, who was also a poet. John Keats, who was a poet. Edgar Allan Poe, the famous mystery and sci-fi writer, was an opiate. He used laudanum. He was actually an alcoholic, and he couldn't tolerate alcohol. Alcohol made him insane. So, in order to break him of his alcohol habit, they gave him laudanum, and he died at 45 in mysterious circumstances as a laudanum addict. Algernon Swinburne was an author, English author. Opium, morphine, and heroin became health concerns in the United States around the turn of the 20th century. In 1906, the Pure Food and Drug Act was passed, limiting the manufacture and the use of opiates. In 1914, opiates became the first drug considered a narcotic in the Harrison Narcotics Act. By 1924, heroin production was outlawed in the United States. 1915, only 63 of the people incarcerated in federal prisons were incarcerated for narcotics violations. And you have to remember, this is when we first started passing narcotics laws. By 1928, 1 out of every 3 people were incarcerated because of narcotics violations, and that was 2,529 prisoners. By 2004, 86.5% of the federal incarcerated prisoners had been convicted of drug offenses. 155,900 prisoners out of 180,328. Because of the market for opiates in the United States, criminal organizations sprung up to supply the demand. Now, you've got to remember that all these groups were from different ethnic groups, and they were organizations that were powerful in their own countries, and they projected that power into the United States to bring illegal drugs into the United States. The Chinese triads, the mafia, which was Italian, the French connection out of Marseille, the Mexican narcotraficantes out of Mexico, the African traffickers, mostly in North and Western Africa, the Russian mafia, and the Colombian cartel, which brought it up through Mexico as well. So as you can see, a lot of different countries became involved in the drug traffic, not just Mexico and Colombia. At present, 4.6 million Americans use opioids illicitly every month. Only 136 to 800,000 of these individuals are heroin users. 3.5 million people in the United States have tried heroin. The rest are prescription drug abusers, OxyContin and Vicodin, or Percocet and Vicodin. Of course, this is all changing. People that become hooked on OxyContin and Vicodin, Percocet and Vicodin, eventually what seems to be happening now is that they are moving on to heroin, stronger stuff in heroin. A new wrinkle that is appearing in Dallas area junior and high schools is cheese. It looks like Parmesan cheese if you could look at it over here. It's a mixture of a little Mexican brown heroin and over-the-counter medications that contain antihistamines. The mixture gives the individual a rush. Several deaths have caused a nationwide scare because these are our school children. Worldwide, 5 to 10 million people are regular heroin users. The United States only consumes about 3% of the heroin produced. The areas that are affected the most are Europe and Asia. They have far more serious heroin problems than we have in the United States. 92% of the world's heroin is produced in Afghanistan, even though we pretend that we control it. Control Afghanistan, I mean, not the heroin trade. Most of the world's legal opium for pharmaceuticals is grown in India. Most of the heroin coming into the United States comes from Mexico. Medically, opioids are prescribed to deaden pain, to control coughing, and to stop diarrhea. Non-medically, opioids are used to drown out emotional pain, to get a rush, to induce euphoria, and to prevent withdrawal symptoms. Pain is transmitted to the central nervous system through the neurotransmitter substance P. The P stands for peptide. The more substance P that is released in the synaptic cleft, the greater the pain. The body modulates the intensity of pain by blocking substance P receptor sites with endogenous painkillers, endorphins, enkephalins, and dynorphins. The endogenous painkillers occupy the substance P receptors, the opioid receptors, which are referred to as mu receptors, kappa receptors, delta receptors, and non-opioid sigma receptors. Exogenous opioids work again because they occupy the opioid receptors, acting as if they were endogenous painkillers. Endogenous painkillers are also activated when an individual feels anxious. It decreases your anxiety. It produces a sense of detachment. It makes the individual feel drowsy. It deadens the unwanted emotions. These effects occur because the inhibiting effect of the endogenous or exogenous painkillers affects on the locus ceruleus. And the locus ceruleus is right here. There's a locus ceruleus. As you can see, it's kind of in the middle of the brainstem. Opiates, opioids induce pleasurable feelings by slotting into receptor sites meant for the endogenous painkillers, inhibiting the action of GABA, triggering glutamate receptors, enhancing dopamine neurons in the reward reinforcement pathway, and increasing the release and enhancing of the effects of dopamine. Heroin has the strongest effect of all the opiates, opioids, because it seems to be the closest configuration to the endogenous opiates. The reward reinforcement pathway performs two functions. It signals pleasure so that an act is more likely to be repeated. It signals the alleviation of pain. Researchers disclose that relief of pain is a stronger incentive than the introduction of pleasure. With psychoactive drugs, especially opiates, opioids, the desire to prevent withdrawal symptoms is a stronger incentive for continued use than the desire for pleasure. When an individual is prescribed opiates, opioids, a non-abuser will use the medication until the pain relief threshold is found. An abuser will use beyond the pain relief threshold, searching for an emotional high. Chronic users of opiates, opioids will use the drug in excess to prevent the withdrawal symptoms. They are seeking to return to the normal state. Opioid and opioid-like receptor sites have different functions. Mu and sigma receptors trigger the reward reinforcement pathway. They block pain transmission. They change mood. They cause pupil contraction. They depress the autonomic nervous system. They depress the respiration and blood pressure. Now, this can be a good thing. It can be a bad thing. If we have too high a blood pressure or we're hyperventilating, then this is a good thing. But if we are just breathing normally and our blood pressure is normal, and we take these and it depresses our respiration and our blood pressure, now all of a sudden we're not breathing enough, and our blood pressure is too low, and potentially our circulatory system will collapse. And if that happens, of course, then we die. One of the interesting things about the pupil contraction, if somebody came into the emergency room and we thought that they had a opioid overdose, first thing we would look at are their pupils, and we would see if they had pinpoint pupils. That's what we're looking for. If they have pinpoint pupils, it means that it's probably an opioid overdose, and at that point, we would probably give them naltrexone, trying to block the opioid. Kappa receptors induce dysphoria. They induce endocrine changes. They control pain at the spinal cord level. Opioids suppress coughs by blocking the activation of the cough center in the brainstem. Codeine and hydrocodone-based cough suppressants are still widely used. Robitussin AC has codeine and hydrocodone in it. Hycoden syrup also does as well. People will abuse these substances for the psychedelic effects. Unfortunately, an overdose of the psychedelic substance dextromethorphan can cause respiratory suppression, nausea, and vomiting. Overdose of cough suppressants is usually in combination with other depressants such as alcohol, benzodiazepines, and antidepressants. Normally, and this was a big thing in the clubs in Hollywood. They would drink cough syrup and they would drink alcohol at the same time. Putting the two depressants together, sometimes they would have an overdose and they would die. Opiates, opioids are also given to control diarrhea. Opiates, opioids work on the brainstem to inhibit gastric secretions and depress the activity of the gastric muscles. Opiates, opioid addicts may suffer from severe constipation. You may have seen commercials on television talking about if you're on opioids, then you need to take this medication to loosen your stool so that you'll have a bowel movement, so you won't be constipated. Sorry. Opiates, opioids affect every part of the body, but especially all these unimportant things: your heart, your lungs, your brain, your eyes, your voice box, your muscles, your cough center, your nausea center, your reproductive system, your excretory system, and your immune system. Now, this is really kind of interesting because people that are longtime opioid users will have a raspy voice, which is just weird. I mean, there are a lot of things that cause raspy voices. Who do we know that has a raspy voice? Um, Wait a minute, the redhead. What is her name? I can't think of her name. Anyway, she's she was in Zombieland. I can't think of her name. Anyway, she's got a raspy voice. Of course, her raspy voice came from when she was a kid. She used to cry a lot because she had a problem, and she cried and she injured her voice box. Um, it's not because of her drugs. Another person is a lady by the name of Nina Blackwood, who was one of the first VJs. And if you hear her voice, you go, my goodness gracious, what's going on with that lady? And as it turns out, she's been a smoker all of her life. She's lucky she's survived up to this point. 65 years old. She's got a really raspy voice. Physical side effects of opiates, opioids, but especially heroin, includes insensitivity to pain, lowered blood pressure, lowered pulse, lowered respiration rate, and confusion. At stronger doses, opiates, opioids, but especially heroin, might cause droopy eyelids, nodding head, slowed, raspy speech. There's that raspy speech again. Slowed coordination and walking gait, pinpoint pupils, histamine release causing itchy, dried skin, suppression of the cough center, hindering the clearance of phlegm, vomiting due to the activation of the nausea center, severe constipation, delayed menstruation, reduced testosterone production in males, dulled sexual desire to the point of indifference. And I'm going to talk about this again probably, but when we're talking about methamphetamine, that's the upper methamphetamine. As we saw in the last chapter, sometimes it is used as an aphrodisiac. A woman who is prostituting herself to get methamphetamine, that makes sense. That's logical because it makes her more sexually receptive. However, somebody who is on heroin, becoming a prostitute in order to support their habit, this is counterintuitive because heroin it dulls their sexual desire, and of course, we can talk about having sex even if you're not attracted to somebody, but it's really tough for these individuals because their sexual desire is completely arrested, and they can't react sexually to anything, to any stimulation. Tolerance of opiates, opioids occurs when the body tries to neutralize the toxin. It does this by speeding up metabolism, especially in the liver, desensitizing the nerve cells that the substance affects, increasing drug excretion by increasing urine, feces, and sweat output, alteration of the brain chemistry to compensate for the effects of the drug. And these are the side effects. This is when somebody is trying to get off opiates and opioids, this is what happens to them. They get diarrhea, whereas before they were constipated. Of course, while they're on the opiates, opioids, Now, of course, their urine output is amazing. The sweat, oh my goodness, these people sweat like crazy, and they stink. Opiates, opioids, tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect. Chronic use of opiates, opioids can cause permanent changes in the brain. Animal studies show that heavy usage of opiates, opioids will reduce the dopamine producing cells in the ventral tegmental area by 1/4. Now, what does this mean if they reduce the dopamine producing cells in the ventral tegmental area by 1/4? Um, uh, that can cause Parkinsonian symptoms because the dopamine, of course, controls this aspect. Hence, these individuals have less ability to feel pleasure or even to feel normal. Another reason to take the drug to make themselves feel more normal. At this point, the body relies on the drug to feel normal, and this is a sad thing. You're looking for normalcy, and the only way you can get it is by taking more and more of a drug. Withdrawal from opiates, opioids may take place in 3 stages. Acute withdrawal, the body tries to return to normal too quickly. The post-acute withdrawal, subtle emotional and physical symptoms such as mood swings and sleep problems that may persist for 3 to 18 months after use of the drug. Protracted withdrawal, more severe emotional and severe symptoms that may start after the first month and last into the 30th week. Your blood pressure decreases, decreased body temperature, decreased respiration, feeling of general uneasiness. This reaction might be triggered by environmental cues that incite memories of their addictive life. These cues can persist for decades after cessation of use. And this is one of the problems with individuals who have been heroin addicts. They may never return to normal. They may feel like they need to use for the rest of their lives. Short-acting opiates, opioids, 2 to 3 hours result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. That includes heroin, morphine, and Dilaudid. Withdrawal peaks at 48 hours and lasts for 5 to 7 days. The reality is that people rarely die of a heroin withdrawal symptoms. It doesn't happen very often. The only drug, the drug that kills you the most because of the withdrawal symptoms is alcohol, and we're going to find that out in the next chapter, of course. But it's like flu-like symptoms for 5 to 7 days. It's not that serious, but the problem is you're not going to feel like you're normal for an extended length of time, probably for a year to 18 months. It's going to affect you, and you're going to have recurrent symptoms. That's not really the right word. You're going to feel like you need to use for decades, potentially, depending on how serious a heroin addict that you were. Long-acting opiates, opioids will delay the withdrawal symptoms for 1.5 to 3 days. And this includes methadone and levoalpha-acetylmethadol, or LAAM. The peak withdrawal hits at the 4th to 6th day, and recovery takes as long as 2 weeks from the long-acting opiates, opioids. Opiates, opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and the long term. That would be codeine, oxycodone, and propoxyphene or Darvon. One of the curious withdrawal symptoms of opiates, opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by the opiates, opioids. So the withdrawal symptoms have to do with a person acting like they're on crystal meth. It's really kind of weird. All in all, people rarely die from opioid withdrawals, as they may do with alcohol or sedative hypnotic withdrawals. The results are similar to a severe case of the flu. The problem with opiates, opioids withdrawal is the fear that the withdrawal since this is the area of the brain that is mostly affected by the drugs. So you become paranoid and you're afraid of the withdrawals. Neonatal effects of opioids usage are extreme because the drugs readily cross the placental barrier. Pregnant opioid users are at risk for miscarriage, placental separation, premature labor, breech birth, stillbirth, and eclampsia. Eclampsia is high uncontrolled blood pressure. It's very difficult to control somebody when they're in eclampsia to control their blood pressure. Once upon a time, about 5 years ago, my niece, my great niece, yeah, she's my great niece. My great niece was pregnant, and she was a drug abuser. She was a heroin addict, and she was pregnant. And she got arrested. I could tell you this lady used to cook meth in my brother bought her a house, or he bought her a house, or he bought a house. He owned a house, and she was living in that house. Well, she started cooking meth in the house, and eventually she moved on to heroin. And then she got pregnant by her supplier. I'm sorry, I don't mean to laugh. She got pregnant by her supplier. So here she is. She's pregnant, and she's a heroin addict. She's used crystal meth in the past. She's used crystal meth in the past. So what does she do? She gets arrested, and when they discovered she was pregnant, and that she was a heroin addict, they sent her to clean up, and they started giving her a synthetic opioid that wasn't as destructive on the fetus as heroin was. And so she was taking this drug, this opioid, to help her with her pregnancy, or to help her with her drug addiction. And smart lady that she is, she used that stuff, but she also would go home, and since her supplier was her baby daddy, she shot up with heroin at the same time. So her son was born severely addicted to heroin and this other stuff. And the kid was in the hospital for the first 6 weeks were touch and go after he was born. He's okay now, but he has lots of interesting problems. And of course, my brother has stopped communicating with me because I understand all of this stuff. So it's embarrassing to him that they allowed this lady to do this. His granddaughter. Is that his granddaughter? Yeah, his granddaughter. Anyway, so I got this stuff in my family. If the fetus survives these dangers, it will be just as addicted at birth as the mother is, though due to size and dilution factors, the withdrawal symptoms are more severe. And of course, this baby almost died multiple times right after it was born. Low birth weight, high-pitched cry, irritability, tremors, exaggerated reflexes, diarrhea, rapid breathing, sweating, vomiting, sneezing, yawning, hiccuping. If the neonate survives the withdrawals, the effects will last for 5 to 8 weeks. This baby was in real serious shape for about 6 weeks. In all, he was in the hospital for 12 weeks. She lost custody of him, and custody was taken by my brother and his wife. The grandparents, yeah, their great grandparents, took custody. Of course, they have given the baby back by this time because, of course, she can do no wrong. That's why they let her do all the stupid stuff she did. In the early 21st century, 4,000 to 5,000 people died from opioid overdoses every year. Last year, 130 people died from opioid overdoses every day. That's a total of 47,450 people. 14 million drug-related emergency room visits occurred in 2017 related to opioid overdoses. This became really serious in the early 2000s. I was out of medicine by that time. When I worked in the emergency room, didn't see that many opioid overdoses, but we did see some to some extent. I was a lab tech, so anytime we thought that they had overdosed on opioids, we were the first people to come down because we had to draw blood from them and get started toxicology uh, investigation. In one study, only 57% of the opioids were accidental. They overdosed on purpose. What opioids overdoses look like: blood pressure drops, the heart isn't beating rapidly enough to circulate the blood. Because the heart isn't beating, the lungs fill up with fluid, resembling drowning. The lips turn blue as the hue begins to imbue the entire body. The pupils become pinpoint, and that's really what we're looking for, the pinpoint pupils. Respiration begins to rasp and to rattle. They go into convulsions as much from the lack of oxygen as from toxins. And their heart, yeah, the heart's beating really slow and not very strong. A lot of times we can't even get a pulse from them. We have to do what's called a Doppler to find their pulse. Death by overdose is one way to die from opioids. Another is to contract a disease from sharing needles. According to research, 50 to 90% of IV heroin users carry the hepatitis C virus. A look at individuals who have only shot up for a year shows a rate of 71.4% of hepatitis C. Hepatitis C used to not be treatable, now it is. We can cure people with hepatitis C. Once upon a time, if you had it, you died with it. 20 to 40% of those infected will develop liver disease, and that was the biggest problem with hepatitis C. A lot of times it would kill you younger than you should have died. 4 to 16% will develop liver cancer. 50% of all IV drug users are HIV positive. 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are male. 7 to 10% of the HIV/AIDS cases in the United States were transmitted through sexual contact with heterosexuals or homosexual IV drug users. 70% of the children with HIV had mothers who were IV drug users or the sexual partners of individuals who were IV drug users. IV drug abusers will do just about anything to get their fix. Heroin fairly quickly scleroses the veins being used for injecting, so the individual has to go to more and more difficult sites for the fix. Their wrist is fairly easy to get to. They go between their toes. They'll inject themselves in their neck. If they are male, they will use the dorsal vein on their penis. That is the top vein on the vein on top of their penis. Heroin users may inject themselves 6 times a day, and sanitation is rarely the top priority. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices. Because the individual is immunocompromised by the drugs being used, the severity of infections are sometimes catastrophic. And of course, the coronavirus, because these people are immunocompromised, this is a situation where if they contract coronavirus, these addicts very often will they become a mortality due to their drug use and the coronavirus. Staph aureus and beta strep group A are just some of the bacteria that will get into their system. I got a really ugly picture. I apologize for that, but this is a really ugly picture of an individual who is suffering from a staph infection. There are several conditions that are more common among IV drug users than non-users. Necrotizing fasciitis is a condition where the virulent bacteria gets under the skin and eats tissue away. And that's exactly what happened to this individual. Endocarditis, bacterial infection of the heart valves, can happen as well. Cotton fever, short-term bacterial infection. And unfortunately, this individual was an IV drug user, and he contracted a serious bacterial infection. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug usage tends to start at different ages. The mean age of first alcohol usage is 16.4. The mean age of first tobacco usage is 17.3. The mean age of first marijuana usage is 17.4. The mean age of first heroin usage is 22.2. From first usage to daily habit averages, about 1 year of sporadic usage. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4 found that after 33 years, more than half were dead, 50 to 100 times greater than the general population. They died of overdose, they died of accidental poisoning, of homicide, of suicide, of accidents, and they died from liver disease. And of course, they were only an average of 56.4 years at the time. Well, they were younger than 56.4 years. Of the people that survived, 44% still used heroin, 67% used tobacco, 22% were daily alcohol users, 35.5% used marijuana, 19.4% used cocaine, 10.3% used crack, 11.6% used amphetamines. The group reported high rates of mental health and health problems. The group now averaged 57.4 years, reported frequent interactions with the criminal justice system. There's a surprise for you. Morphine is metabolized. Now we're going to talk about all the different opiates, opioids. Morphine is metabolized by the liver 3 to 6 times. The morphine must be ingested to get the same effect as an individual gets from an injection. 3 to 6 times the morphine must be ingested. Morphine will be detectable in the urine for several days after ingestion. 1 out of every 6 Americans has a chronic pain problem due to arthritis, back injury, cancer, burns, severe tissue damage, or severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain users. In one research of chronic pain sufferers, 72% had suffered for more than 3 years and 34% suffered more than 10 years. From this research, about half were afraid to use opioids, muscle relaxants, or sedative hypnotics because the fear of tissue dependence and addiction, the fear that the painkiller would mask more serious diseases, fear that they might be thought of as a drug seeker trying to supply a habit. Risk factors in morphine addiction includes kidney and liver problems, drug abuse history, medical drug usage, mental health history, hereditary factors that make the patient more susceptible, like my great nephew, who will always be more susceptible to addiction because he was an addict when he was a newborn. Codeine is used for cough suppression. As a cough suppressant, it is a Schedule II drug, and when it is mixed with another drug for pain control, it is a Schedule III drug. Codeine was the first widely prescribed and abused opiate in the United States. Its #1 ranking has since been taken over by Vicodin, or also known as Hydrocodone. Pimp C and DJ Screw are dead from cough syrup overdoses. These were two individuals that were on in the club scene in Hollywood, and they would drink alcohol and drink cough syrup, and they overdosed on the dextromethorphan. Hydrocodone is also known as Vicodin, Hycodan, Tussin, or Norco. It's a Schedule 3 drug. 120 million prescriptions were written for Vicodin in 2006. Abuse of this drug usually is precipitated after the drug has been prescribed legally. Heavy abuse has been known to cause hearing loss. 600 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants. And the other depressant is usually alcohol. Methadone, Darvon, and Demerol were developed in German laboratories during World War II when the Axis powers were cut off from their supply of opium to provide painkillers of a similar caliber to morphine. Methadone is less powerful than morphine and lasts longer in the individual's system. Methadone is authorized in the United States as a treatment for heroin addiction. There are 1,292 methadone treatment programs in the United States with 228,000 heroin addicts. Hydromorphone or Dilaudid is refined from morphine and gram for gram is 7 to 10 times more potent than morphine. Because of its potency, hydromorphone is stringently controlled. At least we try to stringently control it. Oxycodone is a semi-synthetic derivative of codeine and is used for moderate to severe pain. Other names for oxycodone are OxyContin and Percodan. This drug is supposed to be taken orally. The effects begin after about 30 minutes. The effects last 4 to 6 hours. It is a stronger drug than codeine, but weaker than both morphine or Dilaudid. This drug can be abused by chewing or crushing it and injecting or sniffing the resulting drug. The manufacturer of the drug has tried controlling abuse by reducing the strengths of their tablets, but they're just getting more of the tablets and snorting as much as they can get a hold of. Meperidine or Demerol, Pethidine, and Mepergan has been around longer than most of the synthetics and the semi-synthetics. Demerol, it is 1/6 the strength of morphine, but is widely used as an injectable anesthetic. In large doses, Demerol can cause sedation and euphoria, which makes it ideal for surgery because it doesn't suppress coughing or have the side effect of constipation. If you've ever been in surgery, one of the things they do is when you get out of surgery, they put you in recovery, and in recovery, the reason that you're in there is because of what they gave you, whatever opiate they gave you, it suppresses your ability to cough. So in order to get out of recovery, what you have to do is you have to cough. The people that the recovery nurses really like are people that are smokers, because smokers are really good coughers. The people that they hate are people like me, people that have never smoked, because it's really hard to get us to cough. This drug is the most, and not only that, but as it turns out, I'm not sensitive to opiates. You have to hit me with a lot of it in order to knock me out. And then I usually don't stay asleep as long as I'm supposed to stay asleep. Any time that they've given me any opiates or opioids to control pain, it didn't work. It just didn't control the pain. I had orthoscopic surgery on my knee, and they sent me home with Hydrocodone. Yeah, Hydrocodone. They sent me home with hydrocodone. So the anesthetic started to wear off, and so I took a pill thinking, oh, good, at least the pain's going to go away. It didn't, and I was awake all night because the pain was so severe. If you've ever had orthoscopic surgery, what they do is they take a garden hose and they jam it in your joint and they move it around. Well, that's not really a garden hose. It's just a little wire, but it hurts because, well, they're moving it around in an area that's not supposed to be moved around in. Anyway, it was really painful. The next day I took some extra strength Tylenol and the pain was gone. And if I had any more pain, I just took extra strength Tylenol and it worked. But the hydrocodone, which was supposed to be a lot stronger um, than the hydrocodone, didn't work at all. Than the Tylenol, I'm sorry, than the Tylenol. When I was 20 years old, I had my tonsils taken out, and they gave me codeine to block the pain from the tonsillectomy. Didn't work. Oh man, and I was in some pretty good agony. The way I controlled the pain was by chewing a substance called aspergum, which is aspirin in a chewing gum, and that took care of it. The codeine didn't touch the pain, but the aspergum did. And they've tried to knock me out before. When I had my heart attack, they gave me fentanyl and morphine, and they gave me a bolus of this stuff, and they said count backwards from 100. So I started counting backwards, and they started cutting on my leg to put in the heart cath, and I'm still awake. I hadn't. It didn't knock me out at all, and here I'm waving my hand and going, "Hey, wait a minute!" And the doctor got mad. They had to hit me with a double dosage of fentanyl and morphine, and that knocked me out. But I swear that I can remember part of that surgery. It hurt. So the whole point is that more that opiates don't work on me. Okay, and it's like 5 to 10% of the population. Opiates and opioids are not are incomplete pain relievers, and that's the way I am, unfortunately. So it's tough to knock me out with that stuff. Weak opioid and Tolwyn is a weak opioid antagonist as well as an agonist. When used in combination with other antihistamines, the drug is reputed to give a heroin-like high. Manufacturers have mixed the drug with naloxone, the opioid antagonist, to reduce its use as an opioid accelerant. This drug is rarely used now to get a high. Tolwyn just does not work anymore. Propoxyphene is also called Darvon, Darvocet, Propocet, and Wyjesic. It is used for mild to moderate pain relief. This drug metabolizes this drug is metabolizes slowly and can lead to overdose or addiction if not monitored. The drug is sometimes used as a replacement opioid for heroin treatment in place of methadone. Only 4% of overdose deaths using opioids have been seen with propoxyphene. That's Darvon. There is a Tylenol. It's not extra strength Tylenol. It's Tylenol D, I think. Anyway, it's got Darvon in it. It's got a hit of Darvon in the acetaminophen. That's what Tylenol is. Fentanyl. Fentanyl was the most powerful of the opioids as it is 50 to 100 times stronger than morphine. It is used pre and post surgery to alleviate excessive pain. It also now comes in a patch for chronic severe pain and in a lollipop. There is also an oral transmucosal tablet called Actic, meant to be dissolved in the mouth, and that works as well. Street chemists have been able to replicate the structure of fentanyl with a powerful drug called China White. And actually, we've got a lot of fentanyl coming in from China. This is a really serious problem. And this stuff has been coming across the Mexican border. They will manufacture it in China, and then they'll ship it to Mexico, and then they'll smuggle it across the border. And that is known as China White. Unfortunately, some of the street drug contains MPTP, which kills the dopamine producing cells in the brain, resulting in Parkinson's disease at best, and at worst, a frozen addict who can't move for the rest of their lives. Now, fentanyl has been a medication that we have used in medicine for a while, about 20 years. But it wasn't a street drug, and now it is. And as you can see, it's 50 to 100 times stronger than morphine. And this stuff has a real kick to it. So really serious problems. Prince died of a fentanyl overdose, as did Tom Petty, died of a fentanyl overdose. Two guitar playing fellows. And this is Michelle McNamara. She is, see, I looked this guy's name up and I can't remember his name. Anyway, she was an author. She was a famous author from California, and she overdosed on fentanyl. I can't think of his name. No, Patton somebody. Anyway, goofy looking guy. That was his wife. He's married to, I can't think of her name. My goodness, I can't think of anybody's name today. I got good news for you. Fentanyl isn't the strongest drug on the market. It's not the strongest opioid. As if fentanyl wasn't killing off enough people, the Food and Drug Administration has approved Disuvia, which is 10 times stronger than fentanyl and 1,000 times stronger than morphine. The drug is so strong that coming in contact with its dust from manufacture can cause an instant overdose. Disuvia, so congratulations, this stuff will soon be in the streets. Not sure what you'll do with it, but I'll tell you, it causes an instant overdose, just the dust. So this stuff is really ridiculously strong. Lovomethyl acetate, LAAM, is a long-acting opioid that is used for heroin replacement therapy. LAAM lasts for 2 to 3 days, whereas methadone lasts for only 1 to 2 days. Because it only has to be taken every third day, take-home doses are unnecessary, as is the case with methadone. LAAM metabolizes in the system too slowly for the drug to be used for pain management. LAAM is more tightly controlled than methadone, and despite its success in treating heroin addicts, the paperwork involved makes it an unattractive alternative than the more widely used methadone. LAAM is rarely used in the United States, but it's used in Europe a lot, and it actually does work. Naloxone and naltrexone are opioid antagonists, blocking all the exogenous and endogenous opioids. These drugs can be given to people who have overdosed on opioids, blocking the deadly effect of the opioid structure. Unfortunately, naloxone is short-acting and has to be frequently administered to block the deadly effects of the opioid chemical. Naltrexone, on the other hand, blocks the effects of the opioid for up to 72 hours to help prevent relapse. Buprenorphine is a powerful opioid agonist at low doses, but at high doses, it becomes an opioid antagonist. At low doses, it is used as an analgesic substitute for morphine. It is 50 times stronger than heroin. At high doses, it has an intense inverse agonistic effect and will block opioids from receptor sites for up to 30 hours. At high doses, it can be used as part of an opioid treatment regimen because it blocks the effect of the opioids while taking the edge from some of the side effects. Clonidine is often used to diminish nausea, anxiety, and diarrhea from the opioid withdrawal symptoms. It also reduces opioid craving. It reduces the overactivity of norepinephrine receptors and can cut withdrawal time in half. Used in conjunction with naltrexone, clonidine can reduce withdrawal recovery from 1 month to 5 days. Stadol and Ultram are new synthetic opioids developed as less abusable or addictive analgesics. Unfortunately, these drugs are still abused and have been classified as Schedule IV drugs. The sedative hypnotics are any drug that relaxes and soothes the body and the mind, the sedatives, and eases anxiety or induces sleep, hypnotics. The two main categories are benzodiazepines and barbiturates. The main benzodiazepines are alprazolam and clonazepam. The common name for them is Xanax and Klonopin. The barbiturates are phenobarbital. The barbitals are the barbiturates. Just under half of all prescriptions for psychiatric medications are written for antidepressants. The first sedatives were bromides, also used as anticonvulsants in the 1850s. The biggest problem with these drugs was the fact that they had a long half-life, so toxic levels could build up in the body. Around the American Civil War, chloral hydrate started being used as a sleep aid and a sedative. It was used to treat tension, pain, insomnia caused by alcoholism, and pregnancy neurosis. It was used as the original Mickey Finn to knock out men so that they could be shanghaied. And of course, we're going to talk about the chloral hydrate later in the chapter. In 1882, physicians began using formaldehyde to control alcohol withdrawal symptoms. It is still sometimes used to treat alcohol withdrawal symptoms despite addictive properties and unpleasant odor. Barbiturates were first developed at the end of the 19th century, and their popularity peaked in the 1930s and 1940s. So if you watch an old movie from the 1930s and 40s, you'll probably talk about some of these things. Phenobarbital, psychobarbital, and phenobarbital. Barbiturates are any compound synthesized from barbituric acid, the phenobarb, phenobarb, and psychobarbital. These substances are highly addictive and fairly toxic, making them fairly dangerous. And that's a problem. Miltown or meprobamate was used fairly extensively as a sedative in the late 1940s into the 1950s, became popular with housewives, and came to be known as Mother's Little Helper. And if you listen to the Rolling Stones, they made a song about Mother's Little Helper. Milltown was really popular in England, and of course the Rolling Stones are from England. Less dangerous than barbiturates, it maintained its popularity until the 1960s when benzodiazepines were developed, and benzodiazepines were less dangerous than the barbiturates. Dilaudid was also used as a barbiturate substitute. Unfortunately, it was weaker than phenobarbital. It was just as addictive as the barbiturates. It is no longer manufactured in the United States. Librium chlorodiazepoxide was the first benzodiazepine developed in 1954. Along with diazepam, Valium, these two drugs dominated the sedative hypnotic market until the invention of Prozac. Thought to be a good alternative to the highly addictive barbiturates, benzodiazepines proved to be very addictive themselves with just as dangerous withdrawals as barbiturates. I was in the military during the Vietnam War, and I was working in medicine at the time. I used to go down to the pharmacy and talk to the pharmacy techs from time to time. Valium and Librium were the two drugs that were very, very popular. They used to deliver all the drugs in gallon containers, but they would deliver Librium and Valium in 5-gallon buckets because they were handing them out so much. The reason they were handing them out so much is because they were giving them to the wives of men who were overseas. Vietnam, if you've never heard about what was going on in Vietnam, went on for 12 years. 8 million men served in the military at the time, and it was a very dangerous place. We lost 57,000 men, which doesn't sound like very many now that we just crossed the 200,000 death mark. We've lost 2,000 people, 200,000 people in less than 8 months. But in Vietnam, over the 12-year period, we lost 57,000 men. Today, there are several new drugs that are being advertised as less addictive. Lunesta, Buspar, Rosarim, Ambien, Lyrica. Only Buspar and Rosarim have proven to be less addictive. Sedative hypnotics proved to be so addictive that their use waxed and waned over the years. At this point in time, benzodiazepines are used sparingly and they have been replaced by psychiatric medications that are less addictive, and there is a lower possibility of adding them to other medications to get high. However, sedative hypnotics can still be abused if the drug is overused when prescribed by a physician. It is used in combination with other psychoactive substances for the synergistic or counteractive effect. The drugs are borrowed or stolen from someone as a form of self-medication. The drugs are obtained by other illegal means, for example, forged prescriptions or buying on the black market. The list of celebrities who have died from barbiturate overdoses is long. Marilyn Monroe had high doses of Nimbutal and chloral hydrate in her system when she died. Dorothy Dandridge had high levels of the tricyclic antidepressant imipramine, also known as tofranil, when she was found dead. Interestingly, Dorothy Dandridge is her movies are being featured on Turner Classic Movies this month. I'm sorry. Yeah, this month. Jimi Hendrix was a notorious mixer of drugs. Hendrix had high levels of secobarbital in his system when he asphyxiated on his own vomit. The drugs were prescribed to his girlfriend. He was taking his girlfriend's drugs. Bruce Lee, the quintessential martial arts expert, died from an allergic reaction to a painkiller contained in aspirin and meprabamate, or Miltown. Freddie Prinze shot himself while under the influence of Quaaludes. Prinze was the star of the hit sitcom Chico and the Man. You don't remember it, but I, of course, do, because I'm a lot older than dirt. Elvis Presley was a notorious prescription pill mixer. When he died, he had 14 different drugs in his system, including codeine, Quaaludes, and methaqualone. Keith Moon was a drummer for The Who and an alcoholic when he tried to clean up. The drug he was using was the sedative clomethazole. He had 10 times the daily dosage in his system when he died. Abbie Hoffman was a 60s anti-war activist. Hoffman was found with 150 tabs of phenobarbital in his stomach. His death, of course, was ruled a suicide. Steve Clark was the lead guitarist for Def Leppard. Clark was found by his girlfriend with respiratory failure from the use of painkillers, Valium, antidepressants, and alcohol. He had painkillers, Valium, antidepressants, and alcohol in his system. Margot Hemingway was an actress and the granddaughter of the iconic author Ernest Hemingway. Granddaughter Hemingway was found dead from an overdose of phenobarbital on the 35th anniversary of her grandfather's suicide. Rob Pilatus, Millie of Milli Vanilli, died of a heart attack induced by a sedative given to him to help with alcohol withdrawals. As stupid as it was, he was taking the drug with alcohol. Dana Plato, the actress from the sitcom Different Strokes, died from a mixture of Soma, which is a muscle relaxant, and Vicodin. Plato had a long history of prescription drug abuse. Old Dirty Bastard, the lightning rod of the rapper band Wu-Tang Clan, died after mixing tramadol, which is a painkiller, with cocaine. Chris Penn, an actor and brother of Sean Penn, died from a mixture of promethazine, which is an antihistamine, and codeine. Chris Penn was also in, not Dirty Dancing, Footloose. He was the cowboy in Footloose. The combination mixed with obesity created a fatal enlargement of his heart, and he died. R&B singer Gerald Levert died from a combination of Percocet, Vicodin, Darvocet, Xanax, and 2 antihistamines. Anna Nicole Smith, the blousy blonde and Playboy bunny from Texas, who shocked the world by marrying a 1 foot in the grave billionaire, died with 11 drugs in her system, including Ativan, Cirax, Klonopin, chloral hydrate, Lexapro, Valium, Noctec, and Zoloft. Strangely enough, she died 2 days after her son died of a drug overdose in her room. She'd just given birth to a child, uh, and he came to celebrate, and he died of a drug overdose. 2 days later, she died of a drug overdose, even though she had just given birth to a baby. Posthumous Academy Award winner Heath Ledger died with 6 drugs in his system: oxycodone, hydrocodone, Xanax, Valium, doxalamine, and temazepam. Michael Jackson had a number of drugs in his system when he died, but the combination that killed him were propofol, lorazepam, midazolam, and Valium, trying to bring him down off of. They had been giving him uppers. Officially, Corey Haim died of pneumonia, but the actor had been fighting drug addiction most of his adult life. He was found unresponsive with lethal doses of Valium, Vicodin, Soma, and haloperidol. He was in, wait a minute, what was he in? Lost Boys. He was one of the people that tried to kill the vampires in Lost Boys. What else was he in? He was in a couple other movies. Amy Winehouse was a notorious drug experimenter who went through rehab several times before her death at 27. She had started several episodes of binge drinking and then abstaining before her death. She died of alcohol poisoning with a blood alcohol level of 0.416, which is 5 times the legal limit. Whitney Houston had a notorious had been a notorious drug mixer most of her adult life. She was found drowned in her bathtub with high levels of cocaine, Flexeril, Benadryl, Xanax, and marijuana. Judy Garland had been a child star and had started a pattern of excessive work days, fueled by uppers and downers. So she'd take the uppers to get going, and then she'd take the downers at night so she could go to sleep. At 47, she died of a secobarbital overdose. So she died of the downers, not the uppers. Philip Seymour Hoffman was a highly touted actor nominated for 4 Academy Awards, of which he won once. He died at 46 from an overdose of heroin, cocaine, amphetamines, and benzodiazepines in his system. He died with the heroin needle in his arm. Tom Petty was a rocker for 4 decades. He died at 66 with 3 forms of fentanyl in his system, along with oxycodone and 3 types of benzodiazepines. Kurt Cobain was the iconic frontman for the alternative rock band Nirvana. While Cobain died of a shotgun blast, he had excessive amounts of heroin and Valium in his system when he died at 27. Jim Morrison was the lead singer for the San Francisco band The Doors. Morrison considered himself a poet and philosopher as well as a singer. Morrison died of a heroin overdose in his bathtub at age 27. Janis Joplin was a rock star from the late 60s and early 70s. She partied with such iconic figures as the Grateful Dead and Country Joe and the Fish. She died at 27 of a heroin overdose. Prince was a singer and songwriter from the 1980s until his death in 2016. His album, Purple Rain, is one of the most celebrated albums of the last 50 years. He died of a fentanyl overdose at age 57. The interesting thing is, 2 days before he died of his fentanyl overdose, he was flying from St. Louis to Minneapolis, his home in Minneapolis, and his airplane made an emergency stop in the Quad Cities. That's where I live right now, which I'm kind of curious. He had actually died on the plane, and they brought him back. And of course, they took him to the hospital, and none of this stuff came out. And then it came out like like a couple hours before they actually found him dead in his apartment, in his house in Minneapolis. John Belushi was one of the major original players on Saturday Night Live. He played Joliet, Jake Blues of the Blues Brothers. 1982, Belushi overdosed on a speedball at age 33. River Phoenix was a child actor from the late 80s who was headed for success. The star of Stand By Me, Indiana Jones and the Last Crusade, and Sneakers. He died of a speedball overdose outside a club in Los Angeles at 23. Chris Farley was a comedian of Saturday Night Live fame. He starred in such movies as Tommy Boy and Beverly Hills Ninja. He died of a speedball overdose at 33, like his hero, John Belushi. At present, benzodiazepines are the most widely used sedative hypnotics in the United States. Benzodiazepines vary in their half-lives and can cause tissue dependence. For this reason, they can be highly addictive with severe withdrawal symptoms. Most physicians only use benzodiazepines as short-term fixes for specific conditions. In order of usage, the most widely prescribed benzodiazepines are Xanax, 34 million prescriptions, Ativan, 19 million prescriptions, Klonopin, 16.7 million prescriptions, Valium, 12 million prescriptions, and Restoril, 7.6 million prescriptions. Benzodiazepines are used to reduce symptoms of anxiety and panic disorders, reduce anxiety and apprehension in surgical patients, to treat sleeping problems, control skeletal muscle spasms, control seizures, dampen acute alcohol withdrawal symptoms. Side effects of benzodiazepines usage is very similar to alcohol. Benzodiazepines are most often abused in conjunction with other drugs as they are used to lessen the effects of withdrawal symptoms. The other drugs that are commonly being used with the benzodiazepines are methamphetamines, cocaine, and heroin. In one study, 100% of benzodiazepine addicts were addicted to other substances as well. The typical benzodiazepine abuser is a white, well-educated, 30-plus female. Benzodiazepines work because they increase the effects of the inhibiting neurotransmitter GABA in the cerebellum, the cerebral cortex, the limbic system. The stronger influence of GABA inhibits anxiety-producing thoughts and overstimulation of neural messages. Benzodiazepines are metabolized by the liver to produce more powerful metabolites. The original drug and metabolites tend to stay in the body for an extended period of time because they are extremely fat soluble. Alprazolam or Xanax is used for generalized anxiety disorder, panic disorder, and depression. Triazolam or Halcion is used for short-term treatment of insomnia. If you've had it for longer than 7 to 10 days, they will treat you with a Halcion. Diazepam or Valium is used for anxiety, skeletal muscle spasms, control of seizures. IV Valium is used as a sedative before surgery, and they have used that on me. Didn't work, but by golly, they used it anyway. Tolerance has to do with liver efficiency. Older individuals will have a stronger reaction than a younger person. Overdose of benzodiazepines can cause dementia-like symptoms in the elderly. Tissue dependence can occur with excessive use over several months or normal usage over a year. Because of the drug's lipophilic properties, even small doses over time can cause tissue dependence and addiction. Withdrawal from benzodiazepines can be severe and take several months to taper off from the drug. Symptoms include recurrence of original symptoms, magnification of symptoms. This is known as a rebound effect, and this is very common with benzodiazepines. In other words, when you go off the drugs, when they wean you off the drugs, your symptoms become worse than they were before you started them. Exaggeration of the recurrence of the symptoms, true withdrawal caused by low GABA, and excess epinephrine and norepinephrine. Onset of withdrawal begins after 1 day with short-acting benzodiazepines and lasts for 7 to 20 days. For long-acting benzodiazepines, withdrawal begins after 5 days and takes up to 28 days for the symptoms to subside. Rohypnol is a benzodiazepine that causes short-term memory loss and sedation. The drug has been used for short-term memory impairment and has been used as a date rape drug since the 1970s. Rohypnol has been banned in the United States along with GHB since 1996 because it was used so frequently as a date rape drug. The individual would slip Rohypnol roofies in somebody's drink or GHB in somebody's drink, and then they would take them. The individual would be somewhat sedated, not completely. They'd take them back They'd take them someplace, and they would rape them. And the strange thing is, they wouldn't remember the fact that they had had any sexual intercourse. Buspar is commonly prescribed as an anxiolytic, anti-anxiety drug, and in combination with an SSRI to treat depression. Buspar does not increase GABA. This drug does not seem to cause addiction and is rarely abused. This drug cannot be used to treat seizures. Lunesta is a hypnotic drug prescribed for insomnia. The drug increases GABA production, leading to relaxation. This substance is only addictive when taken with another drug. Placidil or chloral hydrate. Placidil is actually a chemical ether. Chloral hydrate is actually 3 molecules of ethyl alcohol fused together. So if you take chloral hydrate, it's like taking 3 shots of something rather than 1 shot, rather than taking a pill. This is drunkenness in 1 pill is what it is. And this is why they used to use it as to Shanghai people. They would drop it in their drink. They're drinking alcohol anyway. They drop the chloral hydrate in there, and the person would they would pass out, and they'd pass out for a number of hours. They would take them back to the ship, and then they'd sail. They'd set sail. So then that's what they call Shanghai, or dropping a Mickey Finn on somebody. Now, if you remember, there were several individuals that had taken chloral hydrate. Anna Nicole Smith. There were several people that had overdosed on chloral hydrate, and they'd taken usually they had taken these drugs with alcohol. So if you take chloral hydrate with alcohol, you'll probably knock yourself out. Both of these drugs are prescribed to induce sleep and have a long history of addictive use and toxic overdose. So they're really dangerous, Placidil and chloral hydrate. GHB is a rapid sleep inducer. GHB increases the body's level of growth hormone, as weird as that is. Its effects are sedation, disinhibition, empathy, sensory enhancement, and euphoria. Its effects last for 3 to 6 hours. So people would drop this in somebody's drink, and all of these things are taking place. They don't remember what's going on. They're receptive to what's going on, to whatever the sexual inducement is, and you've got 3 to 6 hours to do what you would with this select individual. GBL and BD these drugs are metabolized into GHB in the system. These 2 substances have been formulated into mint-flavored rave elixirs. They use them at raves, okay, and they're called Blue Nitro, Revivrant, Gamma G, Rimforce, and Insom X, because they turn into GHB in the system. Methaqualone or Quaaludes or Mandrax effects are similar to those caused by alcohol and linger for 60 to 90 minutes. The sedating effects last for 6 to 10 hours. This is a drug that is often abused in South Africa. Quaaludes can also be used as a date rape drug because if you drop this in somebody's drink, it will knock them out fairly quickly. But they are actually sedated. It's not like GHB or roofies where they're actually functional. With Quaaludes, it knocks them out completely. This is what Quaaludes was. This is what Bill Cosby was using when he was molesting the people that came to his house. He was using Quaaludes. Lyrica. This drug is used to treat nerve pain from the shingles or diabetes and can be part of seizure treatment. More recently has been used for the treatment of anxiety, sleep, and mood disorders. This substance is rarely abused alone, just like Lunesta. It's usually abused with other drugs. Resarim activates melatonin receptors in the brain. Melatonin is a substance that helps maintain the circadian rhythm. Used for short-term treatment only. When taken with alcohol, the result can be toxic. These three drugs, the Z hypnotics, are short-term, short-acting drugs with 1 to 4 hours of half-life. Excess use causes nausea, headaches, diarrhea, and drowsiness. These drugs are rarely abused except with other drugs. They are used as sleep inducers, the famous Z drugs. And that is the end of the chapter. Okay, I'm glad I got through it. This is kind of a long lecture. I will talk to you later. You guys stay safe, and I will see you next week. We'll talk about alcohol next week as much.